Today we are going to discuss a patient has vaginal bleeding after 24 weeks. After checking the patient introducing himself, you will start to see the information about the patient. The name of the patient, how old is she, and her nationality, and for her social status, and her obstetric history, and if she was using a method of contraception or not, and what is her blood group, and what is the RH typing, and what's her job, and where she is living, and what is special have alcohol or smoker or addict, and for she's smoking or not, if she's smoking for how many days cigarettes she's smoking per day, and for how long she is smoking for how many years. The patient complains of vaginal bleeding, and so we take last menstrual date, first date of last menstrual period, and then she is sure of it or not, and her cycle was regular or not, and she was using hormonal contraception before or not, and we can calculate the expected date of delivery, and then we can calculate the gestational age of the patient, and then we can discuss the bleeding, when the bleeding starts, since hours or days, and the cause of the bleeding is continuously increasing or severe, then stop, or bleeding mild and heavy and then trickling, or was moderate and then stop. The amount of the bleeding, minimal blood clots or small blood clots or large or severe bleeding, for how long she's bleeding since minutes or hours or days, and there's any color change of blood, it's fresh blood, red blood becomes brown and then red again, or brown blood and then becomes red, and then we ask about she has previous bleeding during pregnancy or not. Is the patient has abdominal pain or not? Abdominal pain before the bleeding or abdominal bleeding after start of bleeding? The type of the pain, continuous pain or diffuse pain or frequent pain associated with frequent colic abdominal pain who lasts for a second, or diffuse dull aching pain associated with colic abdominal pain and stabbing abdominal pain or stabbing abdominal pain on the left side of the uterus. If the patient is feeling the fetal movement or she lost the fetal movements, normal or diminished, no fetal movements or absent fetal movements before the start of the bleeding. If the patient has hypertension or not, if the patient has trauma to abdomen, heavy exposed to abdominal trauma, falling. If she was have a visit to her obstetricians last day before she did amniocentesis or external cephalic versions, if she has cesarean section or hysterectomy or myomectomy, the patient is receiving antihypertensive or antiepileptic drugs or anticoagulants or aspirin. And then we ask about how many pregnancies and she has previous bleeding in any pregnancy before or not. She has bleeding with your placenta previa, or bleeding twice from placenta previa, or once from apoptotic placenta, or twice from apoptotic placenta. And we can analyze obstetric history of when the pregnancy occurred, in which year, and how it lasts for how many weeks, and any problems during pregnancy and the pregnancy and delivery abortions. In case of delivery, it is vaginal delivery, forceps or cesarean sections. Any neonates is living or dead, male or female, and what the weight, and any obstetric complications, and any neonatal complications, and she is breastfed her baby for how many weeks. If she has an ultrasound during pregnancy for localization of the placenta or not, and the low-lying placenta, or placenta is fundal, or placenta previa, or placenta previa. And we shift to examine the patient, the general condition of the patient's weight, the pulse and blood pressures, and the respiratory rate, she has pallor, she has leg edema or not. Then we shift for abdominal examinations. We follow the abdominal enlargement, edema of the abdominal wall, fetal movements, and then we palpate the uterus. The right here, fetal limbs felt under, or fetus is felt under abdominal wall in case of ruptured uterus. And then the uterus is contracting or not contracting, or fetal movement is felt or not felt. Then we determine the fundal height, and then we do the lateral grapes and fundal grape to determine where the head of the fetus or the buttocks, and lateral grapes determine where the back of the fetus or the limbs. In first pelvic grape, the head is floating or buttocks on second pelvic grape, and then we auscultate the fetal heart sound, is regular or there is deceleration or absent fetal beat to beat variability. Then we go to vaginal examination. We inspect for the bleeding, brown discharge or fresh blood or blood clots or bloody liquor, and we can do speculum examinations to determine the bleeding blood coming from the cervical canal, or brown blood comes from cervical canal, blood clots coming from cervical canal, or the cervical origin bleeding, cauliflower cervical mass bleeds, cervical polyp bleeds, malignant ulcer bleeds, or cervical ectopic, and we thank the patient. So at the end of the examination, we can determine that the patient has placenta previa, or a ruptured placenta, or suspicious of ruptured uterus, or vasa previa, or the bleeding is due to local lesions on the cervix. Thanks.